Did you know that liver disease is the fifth leading cause of death in North America? Even more alarming, many people don't experience any noticeable symptoms until the disease has progressed significantly. That's why it's crucial to pay attention to the subtle clues your liver might be sending. This incredible organ processes everything you eat, drink, and absorb, filtering out toxins and ensuring your body functions optimally. But what happens when this essential system starts to falter? The scary truth is that over 100 million people worldwide are living with some form of liver disease, and many are completely unaware. Could your body be sending you subtle warnings that you're overlooking? Nestled in the upper right quadrant of your abdomen, the liver is a true multitasker. It's involved in digestion, metabolism, immunity, and the storage of essential nutrients. When your liver is distressed, it can disrupt a vast network of bodily processes. Understanding the often overlooked signs of liver dysfunction is crucial for maintaining your overall health and well-being. Don't wait for a major crisis. Learn to recognize the whispers before they become screams. Recognizing these signals is crucial for maintaining your overall health, and today we're going to dive into 14 weird distress signals your liver might be sending you. From the subtle to the surprising, these signs can indicate that your liver needs some TLC. We will share with you several factors that increase the risk of liver disease and also how to protect your liver. So, are you ready to listen to your liver and find out what it's trying to tell you? One of the biggest misconceptions about liver health is that it only affects people who drink alcohol excessively or have a history of liver disease. But the truth is, anyone can experience liver issues, and the symptoms can be incredibly subtle. For example, did you know that fatigue, mood swings, and digestive issues may all be linked to liver problems? These symptoms can be easy to brush off as stress or a bad diet, but ignoring them can lead to serious health consequences. While alcohol is indeed a major contributor to liver disease, other factors like viral infections like hepatitis B and C, autoimmune diseases, genetic disorders, and even obesity can take a toll. Non-alcoholic fatty liver disease, NAFLD, linked to poor diet and sedentary lifestyles, is becoming increasingly prevalent. It's time to break free from the misconceptions and understand that liver health is a concern for everyone, regardless of their lifestyle. Another common misconception is that liver disease only affects older people, but in reality, liver disease can affect anyone, regardless of age or lifestyle. And because the symptoms can be so subtle, it's easy to ignore them or misdiagnose them as something else entirely. For instance, skin issues like acne, eczema, and rosacea can all be linked to liver problems, but most people wouldn't think to connect the dots. We're often told to listen to our bodies, but when it comes to liver health, it's easy to tune out the subtle signals our bodies are sending us. We get caught up in our busy lives and brush off symptoms as no big deal, but ignoring those signals can have serious consequences. By being aware of these unusual symptoms, you can take action to protect your liver health and prevent more serious problems from developing. Our livers are incredibly resilient, but they're not invincible. When we neglect our liver health, we're putting our entire body at risk. So it's time to start paying attention to those weird distress signals your liver might be sending you. From the bizarre to the baffling, these symptoms can indicate that your liver needs some serious TLC. So what are these 14 weird distress signals your liver might be sending you? Let's dive in and explore each one. Number 1. Skin transformations. The skin is often the first place to show signs of liver distress. Jaundice. This yellowing of the skin and eyes is a classic sign of liver dysfunction. It occurs when bilirubin, a yellow pigment produced during the breakdown of red blood cells, accumulates in the bloodstream. A healthy liver typically filters out bilirubin, but a compromised liver can't keep up, leading to its buildup and the characteristic yellow discoloration. Itchy skin, intense itching, especially without a rash, can be another sign of liver problems. This often occurs due to a buildup of bile salts, which are normally excreted by the liver, but can accumulate in the skin when liver function is impaired. Easy bruising or bleeding. The liver plays a crucial role in producing clotting factors, essential proteins that help stop bleeding. When the liver is damaged, its ability to produce these clotting factors may be reduced, leading to easy bruising, prolonged bleeding from cuts, or spontaneous bleeding, like nosebleeds or bleeding gums. Number 2. Fluid retention, also known as edema. The liver is vital in maintaining fluid balance in the body. When liver function is compromised, it can disrupt this balance, leading to fluid buildup in the tissues. This often manifests as swelling in the legs and ankles, and in more severe cases, Fluid can accumulate in the abdomen, a condition known as ascites. Number 3. Changes in urine and stool. What goes in must come out, and changes in these elimination habits can provide valuable clues about your liver's health. Dark urine, bilirubin, the same pigment that causes jaundice, can also turn one's urine dark brown or tea-colored. This is often one of the earliest signs of liver dysfunction. Pale or clay-colored stools. Bile, a digestive fluid produced by the liver, gives stool its normal brown color. When the liver is unable to produce or excrete bile properly, stools may become pale, clay-colored, or even grayish-white. Number 4. Abdominal pain. The liver is located in the upper right quadrant of the abdomen, just below the rib cage. Discomfort or pain in this area can be a sign of liver inflammation called hepatitis or enlargement, known as hepatomegaly. The pain may be dull and achy or sharp and stabbing, and it can worsen after eating or drinking. Number 5. Nausea or vomiting. The liver plays a role in digestion by producing bile, which helps break down fats. When liver function is impaired, digestion can be disrupted, leading to feelings of nausea and vomiting. Number 6. Loss of appetite. Liver problems can affect your metabolism and hormonal balance, leading to a decreased appetite and a feeling of fullness, even after eating small amounts of food. This can result in unintentional weight loss and nutritional deficiencies. Number 7. Fatigue. Persistent fatigue and lack of energy are common complaints among people with liver disease. The liver is involved in various metabolic processes, including energy production and storage. When the liver is not functioning properly, these processes can be disrupted, leading to feelings of exhaustion and weakness. Number 8. Mental confusion and cognitive impairment. In advanced stages of liver disease, toxins can build up in the bloodstream and reach the brain, a condition known as hepatic encephalopathy. This can lead to a range of cognitive problems, including confusion, disorientation, forgetfulness, difficulty concentrating, sleep disturbances, and even personality changes. Number 9. Bad breath. A distinctive sweet or musty odor on the breath, often described as musty or garlicky, can be a sign of advanced liver disease. This odor is caused by the buildup of certain chemicals in the body that the liver normally filters out. Number 10. Spider angiomas. This is a collection of small dilated arterioles or blood arteries crowded at the skin's surface. The cluster of vessels is web-like, having a core point and radiating vessels. Spider nevi can appear anywhere on the body, but they are most frequent on the face, neck, and legs, especially in sun-exposed areas. Some people may experience discomfort or burning near the vessel cluster. This soreness is more common when the vessels are in the legs and after prolonged standing. Number 11. Palmar erythema. Palmar erythema affects roughly 23% of people with liver cirrhosis. Cirrhosis develops when your liver is extensively scarred and the healthy liver tissue is replaced by scar tissue as it seeks to repair itself. This condition causes redness and warmth in the palms of the hands, particularly the fleshy parts at the base of the thumb and little finger. Like spider angiomas, palmar erythema is often linked to hormonal imbalances caused by liver disease. Number 12. Enlarged breasts in men. The liver plays a role in hormone metabolism, and liver disease can disrupt this balance. In men, this can lead to an increase in estrogen levels relative to testosterone, which can cause breast tissue to grow. Number 13. Unexplained weight loss. While weight loss can be a positive goal for many, unexplained weight loss, especially when accompanied by other symptoms, can be a sign of underlying health problems, including liver disease. Number 14. Bleeding easily. The liver plays a crucial role in producing clotting factors, essential proteins that help stop bleeding. When the liver is damaged, its ability to produce these clotting factors is reduced, leading to easy bruising, prolonged bleeding from cuts, or spontaneous bleeding such as nosebleeds or bleeding gums. In no particular order, below are some factors that increase the risk of liver disease: heavy alcohol use, obesity, type 2 diabetes, tattoos or piercings, sharing needles, blood transfusions before 1992, exposure to blood and bodily fluids, unprotected sex, exposure to chemicals, and family history of liver disease. So how do you protect your liver? Below is a practical guide. Taking care of your liver is easier than you might think. It starts with being mindful of your alcohol consumption. If you enjoy a drink, remember that moderation is key. Knowing your limits is essential, as excessive alcohol consumption can take a serious toll on your liver. Making smart choices in other areas of your life is also important. When it comes to sexual health, Protect against hepatitis B and C, which can be transmitted sexually. If you're considering tattoos or body piercings, be sure to choose reputable shops that prioritize hygiene and use sterile equipment to minimize the risk of infections that could affect your liver. And remember, sharing needles to inject drugs dramatically increases the risk of contracting these infections. If you or someone you know struggles with substance use, seeking professional help is crucial. Speaking of protection, talk to your doctor about getting vaccinated against hepatitis A and B, especially if you have any risk factors for these infections. Even if you've already had a hepatitis infection, vaccination can offer protection against other strains. Being mindful of your medications is another important aspect of liver health. Always take prescription and over-the-counter medications as directed, and never exceed the recommended dosage. Avoid mixing medications with alcohol, as this can increase the risk of liver damage. And if you're considering taking herbal supplements, consult your doctor first, as some can interact with medications or have negative effects on the liver. Practicing good hygiene can also help protect your liver. Hepatitis viruses can be transmitted through contact with infected blood and bodily fluids, so it's important to be cautious and maintain good hygiene practices, especially in healthcare settings or when someone is injured. Food safety is another crucial factor. Always wash your hands thoroughly before eating or preparing food to prevent the spread of germs that can cause liver infections. When traveling to areas with potentially unsafe water, stick to bottled water for drinking, brushing your teeth, and washing fruits and vegetables. When using aerosol sprays like insecticides, paints, or cleaning products, ensure you have proper ventilation to avoid inhaling toxic fumes. Wear a mask for added protection and always follow the manufacturer's instructions carefully. Similarly, when handling insecticides or other toxic chemicals, wear protective clothing, including gloves, long sleeves, a hat, and a mask to prevent chemicals from being absorbed through your skin. Finally, maintaining a healthy weight is crucial for liver health. Obesity is a major risk factor for non-alcoholic fatty liver disease, also known as NAFLD, which can lead to serious liver damage. A balanced diet and regular exercise can help you maintain a healthy weight and protect your liver. So what do you do if you're experiencing some of these weird distress signals? First and foremost, don't panic, but do take action. If you're experiencing any of these symptoms, it's crucial that you speak with a healthcare professional to rule out any underlying liver problems. By being aware of these unusual symptoms, you can take action to protect your liver health and prevent more serious problems from developing. Remember, your liver is like a silent guardian, working behind the scenes to keep you healthy and thriving. So listen to it. Remember, early detection is crucial for effective treatment and management of liver conditions. Don't hesitate to talk to your doctor if you have any concerns or experience any of these symptoms. We would love to hear from you in the comments. Have you experienced any of these weird distress signals? What did you do to address the issue? Share your experiences with us, and don't forget to hit that subscribe button for more health-related videos. Thank you for watching.